I'd like to thank Dr. Kiran Joshi and Dr. Rachel Rubin, Senior Medical Officers at Cook County Department of Public Health, Bill Barnes, the Executive Director of Cook County's Department of Emergency Management and Regional Security, for joining us today from the county side. I'd like to thank Chief Mitchell Davis of the Hazel Crest Police Department, and Chief Mike, you're going to have to tell me how to pronounce your name, Mike.
Mavra George, ma'am.
Mavra George. Okay, did I do that close?
Yes, ma'am.
All right, Mavra George. Thank you very much, Chief, from the Oak Lawn Police Department. I'm very grateful to all of you, and particularly our chiefs from Hazel Crest and Oak Lawn who represent first responders on the front lines of the fight against COVID-19. We're extremely grateful for your service to our residents at this really challenging time for our communities and our county. It isn't the first time that I've thanked our workers on the front lines of this pandemic, and it won't be the last. You and the men and women in your departments come to work each day and risk your own safety, your very lives, for the residents you serve. And it's not that you don't fear for your safety, but your courage overrides that fear. Our gratitude is tremendous. Our first responders, our healthcare community, both in our hospitals and our nursing home settings, workers in correctional facilities, all face an additional burden when they leave work each day. They fear bringing the virus home to their loved ones. We owe it to them to provide a safe place to quarantine if they may be exposed to COVID-19 but are not experienced any symptoms. We must protect their loved ones while they protect us. That's why Cook County has created a respite program for these dedicated professionals and have tailored it to prioritize workers who may not have the financial ability to rent a hotel room for an extended stay. We hope this program will give our healthcare workers and first responders the peace of mind that they have a place to go where they will not be exposed to not exposing the coronavirus to their families. It will also help us stop the spread of the virus. While so many in our communities are coping with shelter-in-place orders to remain safe, our healthcare workers, our firefighters, our police officers, our paramedics, and workers in correctional institutions do not have that option. While Cook County continues to find more ways to assist them, each of us has a role in this fight too. Please continue to stay at home. Please social distance when you must go out. Please wash your hands with soap and water for at least 20 seconds or use alcohol-based hand sanitizer. Please heed the advice of our medical experts and scientists. I'd like to introduce next Dr. Kiran Joshi, who's Senior Medical Officer at the Cook County Department of Public Health, to give additional details about the county's respite housing plan. But before I do that, I want to acknowledge our sign language interpreters today, Donna Stanton and Amanda Grazian. All right, thank you very much, Doctor.
Thank you, Madam President. Thank you, Chiefs. Good morning.
Good morning.
Thank you. Thank you to our partners at EMRS and IEMA for working with us to identify and secure additional alternative housing options for healthcare workers, first responders, and correctional employees who live and work in suburban Cook County. Given the limited supply of hotel space, we're really focusing on individuals who are on workers who are on the front lines helping to prevent and control the spread of COVID-19. Workers who don't want to risk bringing COVID-19 home to family members and who are at increased risk of severe illness, complications, or possibly death. These are folks who cannot afford to effectively quarantine themselves at home, and this means not having a spare bedroom or a bathroom that they could use for this purpose. We encourage folks to take a health equity approach along with us to ensure that our most vulnerable residents have quality, safe spaces to quarantine under the stay-at-home order. And again, are prioritizing folks who would not otherwise be able to afford renting a hotel room. This respite housing will be offered in 7-day increments and will ask folks to renew based on availability and based on the Public Health Department's current assessment of the threat of coronavirus at the time. Again, this is respite housing that's needed for folks who must quarantine themselves because they have jobs that put them on the front lines of the response. If individuals develop symptoms, we are able to put them into isolation. That said, I'd like to turn it over to my co-lead and our incident commander at the Cook County Department of Public Health, Dr. Rachel Rubin, to provide a brief situational update. Thank you.
Thank you, Kiran. So for some of the numbers from the recent period, as of yesterday, April 21st, there were a total of 33,059 confirmed COVID-19 cases and 1,468 deaths in the state of Illinois. Of that total, 23,181 cases and 1,002 deaths occurred in Cook County, including 9,627 cases and 433 deaths in suburban Cook County, and 13,554 cases and 569 deaths in the city of Chicago. So to protect the health of suburban Cook County residents, the Cook County Department of Public Health is actively investigating about 100 long-term care facilities or congregate settings, each with at least one confirmed COVID-19 case, as well as associated cases of those. So long-term care facility residents are at high risk of being infected and affected by COVID-19. Risk factors associated with living in a congregate setting and characteristics of the population served, meaning they're often older adults with chronic medical conditions, can result in more severe disease from COVID-19 in those individuals. So we really need to be targeting these congregate settings. You know, people are concerned about what is happening specifically in nursing homes. We are concerned also in the health department. Long-term care facilities, including nursing homes, have been and continue to be a top priority for local and state public health departments. The state is responsible for nursing home licensing, but the local health departments are responsible for infection control and guidance. When we become aware of a nursing home with a case, we open an investigation to ensure the facilities are up to date in the most recent guidance for infection control. If they are not, we work with them on an ongoing basis, including checking in regularly, daily if necessary, to answer questions as they arise and to help them put measures in place to protect the health of residents and their staff. So to see which nursing homes have at least one confirmed case in Cook County or throughout the state, you can visit the state corona website page at dph.illinois.gov/COVID-19. And for more information, including resources and answers to frequently asked questions related to COVID, you may call our hotline at 708-633-3319, or of course visit our wonderful website at www.cookcountypublichealth.org. Thank you. Okay. I think. Bill?
Yep.
Hi. Good morning.
Good morning.
Thanks. Executive Director, Cook County Emergency Management and Regional Security, and thanks to you, Madam President, for your leadership in this crisis. Your focus on underserved, under-resourced, and economically challenged communities are the lodestar of how we are driving this response. And I also want to say thank you to our friends at Cook County Department of Public Health, Drs. Rubin and Kiran, Joshi. We would be at a loss without your clinical guidance, so thank you very much for your cooperation and collaboration. And I'd also like to express my gratitude to our representatives of the first responder community here. We have Chief Mitch Davis from Hazel Crest Police, and then Chief Mike Mavergeorge from Oak Lawn Fire. You, along with your teams, your staff, your employees, are truly on the front lines of this battle, this COVID-19 battle. And I know I speak for my staff and all of the county when I tell you that we're honored to support all that you do. Just last week I stood before you to announce alternative housing being stood up by Emergency Management and Regional Security in conjunction with Cook County Department of Health for Those folks who are being released from hospitals that were COVID positive but asymptomatic and unable to return home for whatever reason that may be. I'm proud to announce that we are expanding that alternative housing to what's known as respite housing for those troops, those individuals who are truly on the front lines of this battle, our first responders, our healthcare workers, both in hospital settings and also nursing homes, first responders, fire, police, and then also correctional officers. Every single day, each and every one of the individuals in these groups, put their lives at risk. They risk being exposed to COVID-19 in the work that they do, tending to the sick, the scared, the wounded, the injured. And the last thing we want them to do is to be afraid to go home to their loved ones, their friends, their families. So by opening up this respite housing, we're giving them a safe harbor in the storm, the ability to isolate themselves from their family for distinct periods of time while the county fights this very important battle. So I would be remiss if I didn't thank again the state's emergency management agency, IEMA. It is through our very strong partnership with them that we were able to identify and secure these houses. So thanks to you, IEMA. As this crisis continues, as we face new challenges in this battle, it is my pledge to you that we will do everything we can to get the resources needed to individuals like our first responders to fight this fight. And I pledge not to stop doing so until this is over. So thank you. I'm going to turn this over to Chief Mitch Davis, Hazel Crest PD. If you could give a few words, sir. Thank you.
Thank you, Director. Good morning, everyone.
Good morning.
As you heard, my name is Mitchell Davis. I'm the police chief in the village of Hazel Crest. I'm also the president of the South Suburban Association of Chiefs of Police, and I want to make sure that I give a sincere thank you to President Preckwinkle for allowing me this opportunity to speak with you. Everyone that knows me knows that I'm a vocal advocate for not just my profession, but for the communities that we serve. My fight has always been for equity in the distribution of supplies, processes, resources, and opportunities, and since the onset of the COVID-19 pandemic, my advocacy has heightened. While my voice is for law enforcement as a whole, my directed focus is for Chicagoland's Southland communities. You may have heard me say last week that I believe that it is both a blessing and a curse to be a suburb in a major metropolitan area. The blessing being the access to the many great things that come along with being in proximity of the city of Chicago. The curse being, while we have so many commonalities, we don't have nearly the access to the resources that Chicago has. And that is especially true in the Southland. On April 2nd, I sent a letter to the South Suburban Mayors and Managers Association expressing a concern that I had about housing being provided for Chicago police officers that had shown symptoms or may have been exposed to the coronavirus. My concern was not that the housing was being offered to Chicago police officers. My concern was that the housing was only being offered to Chicago police officers. My proposal dealt with the partnership between first responders, healthcare workers, and hotels in the Southland. I have also shared this letter with elected officials at the local, county, state, and federal levels. Again, my concerns were focused on our Southland communities because equity often seems to evade us in times of need. I soon learned that there was a process in the works for housing in the form of what I was looking for. And last week, before speaking at a different press conference with President Preckwinkle, I shared my thoughts with Director Barnes on this matter. Director Barnes informed me that he was already working with President Preckwinkle on implementing exactly what I was looking for. Their work has culminated in the development of the respite housing plan for first responders. And I want to sincerely thank President Preckwinkle and Director Barnes for making this a priority. This program is solely about protecting the family members and loved ones of those that cannot shelter in place. As first responders, we know what we signed up for, and we honorably do our part in fighting this COVID battle without hesitation. But while our officers are willing to sacrifice all, it is my responsibility as a leader to fight for equity for those that I serve. Equality is giving everyone the same thing. Equity is giving someone everything that they need to make them equal. I would like to again thank President Preckwinkle and Director Barnes for making sure that we in the Southland are being treated equitably. God bless you, stay at home, and stay safe.
Thank you, sir. Now I'd like to ask Chief Mavro George of the Oaklawn Police Department to say a few words as well.
Hello, my name is Mike Mavro-George. I am the Fire Chief of Oak Lawn, and I'm also the President of the International Association of Fire Chiefs Great Lakes Division. President Preckwinkle, thank you for your strong and steadfast leadership through all of this, as all of us here in Cook County weather this storm together. I would also like to acknowledge Director Barnes, Chief Davis, for their leadership during this crisis. And also, I would be remiss if I did not recognize the great work that the Cook County Department of Public Health has done through this crisis. Throughout this crisis, your firefighters and paramedics have been at the forefront of providing initial emergency care and transporting patients to emergency departments at hospitals where great teams of nurses, doctors, and technicians care for them. All first responders and healthcare workers understood when we swore an oath to protect and care for our citizens, that we could be called upon to place our lives in danger, and if necessary, sacrifice our lives for the greater good. This is part of our duty, and we accept it. The COVID-19 pandemic has forced all first responders and healthcare workers to face a very different and dark fear. The possibility that in protecting and caring for our citizens, we could bring COVID-19 into our homes and infect, even kill our own loved ones. No one signed up to harm their families. This is why the respite housing plan is so important to first responders and healthcare workers. If we are potentially infected with COVID-19, this program will provide safety for our families and peace of mind for our responders. I want to thank President Preckwinkle and all of the agencies involved in the development of this plan on behalf of the Fire EMS service in Cook County. Thank you.
Thank you. Chief Mavro George is a firefighter. I apologize. Thank you.
I was a police officer when I started.
All right, there you go. So you were both. Okay, good. All right, questions?
Hi. Yeah, this is Rachel.
Yes, Rachel.
Can you explain where this housing will be, as well as how many spaces are available for first responders and how many first responders will be able to use them?
All right, Bill, it's where it's located and the number of units.
Thanks. Right now, we have 460 rooms that are available in Schaumburg, and then we are soon to open a facility in Oak Lawn that will have approximately between 60 and 100 rooms. The plan that we have for housing, be it alternative housing for COVID-positive folks or respite housing, is scalable, so as the need arises, we will open additional housing to accommodate the needs expressed by our suburban partners.
And is this at like hotels or
Where?
somewhere else?
Yes, I'm sorry. These are in hotels, and the idea is that this is a safe harbor for these individuals to hunker down in their off hours. It's not to be seen as a vacation. The idea is to minimize exposure and minimize the spread of the disease. So the idea is to have a self-contained room with its own bathroom and own ventilation system, so that these folks can, relax at the end of the day and then leave and go into work the next day and come back. That answer your question?
Yes, thank you. And you said that people will have 7 days. This will be allowed in 7-day increments, and then people can reapply for this. Is that correct?
That is correct, yes. We're going to start with 7 days, and we need to keep this scalable. We also need to keep an eye on availability of rooms, and also need to respond to public health guidance as it comes out from the Cook County Department of Public Health as it relates to the community spread as well.
Thank you. WBEZ.
Yes, Kristen?
Yeah, hi. Just to follow up, Bill, can you give us the total number then of hotel rooms available now? So, we've got, sounds like, 560 or more for the new respite housing for first responders, healthcare workers. But then in terms of for patients, can you remind me again how many are available for them? Just so we have a total perspective of all that the county's doing for alternative housing.
Certainly, that's a great question, and I certainly didn't want to ignore the good work we're doing on the alternative housing standpoint. There is an existing hotel in Schaumburg that has, I believe, 275 rooms that is set aside for the alternative housing side of things, the COVID positive individuals, and that is in addition to the 500 plus rooms that we have for respite care.
Okay, so those total together, that's for the patients plus first responders, healthcare workers, the correctional officers.
Yes.
Right. Okay. And then, Preckwinkle, can I ask you something a little bit off topic, but related to all of this? We're going to have the first county board meeting tomorrow in about 2 months. Can you give us some insight into the impact of COVID-19 on the county budget? What that looks like? I realize this changes every day. This is just a snapshot, but I just wondered if you can give us that sense, because we're getting that sense from the city and the state as well.
Frankly, our chief financial officer, Maritsky, and his team are looking at both the impact on revenue and expenditures. We're really challenged because we have a public health system that's heavily impacted by COVID-19 patients. When I last spoke to Deborah Carey, half the beds in the hospital were taken by COVID-19 patients. So our healthcare impacts are considerable, and as you're well aware, several weeks ago, the Centers for Disease Control and Prevention told all of our hospitals in this country to cease elective surgery so that healthcare professionals and beds would be available for COVID-19 patients. And that was one of the principal ways in which we raise revenue in our health and hospital system, elective surgery. So there's an impact both on the revenue side, in terms of lost revenue, because of the termination of elective surgery, and an impact in terms of the number of people that we have to care for who are COVID-19 patients, many of whom are uninsured. So our health and hospital system, which is half our budget, is really heavily impacted by the virus. And on the criminal justice side, as you're well aware, we've been working to mitigate the impact of the crisis on our jail by releasing as many people as we possibly can who are detained in the jail accused of non-violent crimes. And I think the jail population is the lowest that it's been in memory. The last time I heard, and don't hold me to this, I'll ask Nick to check, there were 4,200 people in our jail. And we've been averaging previously, the jail population for the last year has been hovering about 6,000. I think on the 13th of March it was about 5,600, and now it's about 4,200. So in the last month, through the good work of the chief judge and our judges, the state's attorney, the public defender, the sheriff, and the clerk of the court, we've reduced the jail population by 1,200 or 1,400 individuals. So we're doing our best to manage under these difficult circumstances. I can't frankly give you a projection of the fiscal impact. Part of it depends on what the federal government will reimburse us for. And we're hoping, of course, for federal legislation for lost revenue. At the moment, the most recent bill, my understanding, does not include a lost revenue provision for local units of government, but it does include money for hospitals, so that's helpful to us, as well as replenishing the payroll protection program pot of money.
Okay, thank you. That's helpful. Do you have a sense of when you think the county will have a better handle on how much it might get reimbursed from the federal government versus how it would make up the difference for not giving that extra money?
I don't know how much money will be coming to us in this latest stimulus package. I think this is the fourth one. But I am told that there's money for hospitals, so we'll see what becomes available to us.
Okay, thank you.
All right, Rachel and Kristen, are there any other folks on the line?
Yeah, this is Justin Lawrence. I'm with the Daily Line. Who exactly is eligible for this? It sounded like it might be limited to people who have the most need. Is that kind of determined by income limits or those who have at-risk family members? Just, who exactly is eligible for the rest of
All right.
this day?
All right, I'm going to ask Bill Barnes to respond. All right, sorry, Dr. Kiran Joshi from the Department of Public Health will respond. Justin on the Daily Line.
Hi, Justin. It's Kiran Joshi. So I would say three broad categories. One, healthcare workers, and the focus there is really on folks that are at highest risk, and in folks that are caring for other patients in congregate high-risk settings. So what that means is hospital workers, and I would emphasize hospital workers who are perhaps working in the emergency room or in ICUs, in which they often do procedures that are so-called aerosol-generating procedures that are very, very high risk. We would also want to prioritize folks that are taking care of our seniors in nursing homes. I want to be clear in that when we say healthcare workers, we mean anyone who works in the healthcare setting, and that includes folks who are low-wage workers, specifically that are, say, perhaps the cleaning staff. I would not want them to be left out. So I want to be really clear about that. The other category is first responders, and I believe we've spoken to that extensively. And finally, the good folks that work in corrections as well. So, anything else?
Justin, did you have any?
So does that mean there's no, there's no income restrictions that's available to anybody who works in these jobs?
It's categories of workers. It's categories of workers, not how much money you make.
Correct. Yeah, there's no means testing.
There's no means testing for this. We're making this available to anybody who needs it in the first responder community.
Okay. All right, thank you. That's fine.
All right, Rachel, Kristen, Justin, is there anyone else on the line?
Yes, JT with the South Suburban News and the Chicago Gospel Tribune.
All right, JT.
I just had a follow-up question regarding first responders. I've had a few calls from individuals who work in healthcare, but work, I'll give you an example, say in a mental health capacity, receiving, patients throughout all the communities in the Southland, Chicago, as well as geriatric psych. And with these individuals, based on their high incidence of contacting people from various areas, also be considered eligible.
I'll ask Dr. Joshi to respond.
Yeah, sure. So I would say broadly, we would want to focus on individuals that are working and caring for folks in congregate settings with high-risk individuals. And some of the institutions that you mentioned would likely fall into that category. I want to also say, we're trying to really limit the administrative burden when it comes to entry. We're not interested in turning anyone away. We want this to be as broadly available and fundamentally useful as possible.
Okay, thank you.
All right, Rachel, Kristen, Justin, JT, any one of you have any more questions? Rachel?
Just a second, I did have, I'm sorry, go ahead, Rachel. No, it's okay, go ahead. I just wondered, Mr. Barnes, can you give us a sense of just the total number of hotels we're talking about in the suburbs for all of this housing, for the patients and the healthcare workers, first responders, and so on, and then what the cost is?
Okay, so the question is the total number of hotels and then the cost.
Yeah, I don't have a specific number of hotels right now. I know that we have 3 under contract right now, which represent the rooms that we previously discussed. In total, we've identified over 8,000 rooms countywide that we could access via contract. We have 2 additional hotels, one in the north and one in the south, that are under contract and could be turned on, quote unquote, as needed. From a cost standpoint, right now the cost, thankfully, is being borne by the state of Illinois through the good graces of the Illinois Emergency Management Agency. I don't have visibility on what that costs, but figure, it's the cost of a room, typically at the government rate, which is slightly reduced, times however many rooms are in that hospital, the hotel. So it can get a little costly, but I would add that these types of housing expenses are reimbursable through the federal government, through the public assistance process. So we are banking on recovering the majority of these dollars through the federal government, and we've been very diligent in tracking our costs and making sure that we have the documentation necessary to prove that the individuals going into and coming out of these hotels meet the eligibility requirements set forth by the federal government.
Okay, thank you.